I've got with me today Anna Hallas and Jeanette Whitehead, who are our experts in cleaning and infection control and health and safety. We'd like to talk to you today about delivering excellence and safety in cleaning services. We think that safety is not something that you just do, that you just take for granted. It's something that you really have to embed into your culture and really ensure that your frontline teams are feeling empowered to do the right thing, to take the right safety precautions and follow all of the protocols. And that's really important when we're looking at our cleaning services and other services within a healthcare environment. So with no further ado, I'll hand you over to Jeanette and Anna, who are going to talk you through that today. And I hope that you enjoy the talk, and I'll speak to you in a while. Thanks.
Good start. Morning, everybody. I'm Anna Hallas. I'm the Head of Healthcare Cleaning and Infection Control for Compass Healthcare, and we're the healthcare arm of Compass Group, so we work in the NHS, in private healthcare and in senior living.
Good morning, I'm Jeanette Whitehead. I'm the Senior Health and Safety Manager for Compass Healthcare. So basically I cover all the health and safety to do with all of those soft services within that sector.
What we wanted to talk to you about today was how we work collaboratively and the impact that has to our frontline teams. So we're both individual SMEs and we both have individual roles, but we work very, very closely together on all things to do with process, procedure, different ways of working, innovation, to make sure that they're safe for our teams. And it's all about making sure that things work operationally for our frontline colleagues. It's all well and good with us coming up with great ideas, but they have to work in a real life environment with real people who are operating. So we always try and test everything in the industry or in our business in hospitals and get feedback from the people who are using the different techniques, procedures, processes and innovations. We also want to talk to you about advancements in cleaning standards and what innovations you can use and what we use to enhance processes and cleanliness. We want to talk about the role of workforce culture, automation and optimisation in maintaining those environments. And we'll overview what can be achieved through this approach. So we want to also talk to you about some of the successes we've had and some of the external accreditations.
So for those of you who don't know Medirest, I'm surprised you don't, we provide soft FM services to the acute healthcare, mental health, private and senior living. So as well as the cleaning services, we do cover catering for patients and retail. We do logistics of patient movement and waste management. We also provide security services into some of the NHS trusts. The principles and processes we're talking about today and our proactive approach to incorporating safety into everything that we do applies to all of these services, but as Anna and Lauren have said, we'll be focusing on cleaning today.
So just to give you a flavour of how do we choose and how we decide what we're going to do? Well, we have 4 tenets that we always measure and operate to. So whenever we're looking at something new, a new process, a new procedure, a new innovation, we have to be able to measure the impact on quality, productivity, infection control and sustainability. And anything new has to meet at least one, if not more, of these tenets. But it always has to meet health and safety requirements. So we look at the health and safety implications before we start. We look at it during any process that we're trialling or testing, and we look at it again if we've actually rolled it out. So it's important that we look at these measurable activities so that we know what it's actually delivering for our frontline colleagues and for our clients and customers within our hospital settings.
So for a majority of you listening, you'll recognise that continuous improvement model of plan, do, check, act. And actually maybe thinking, well, safety's just business as usual, isn't it? But this is about being proactive and putting that safety first. Our safety culture starts with our people who live and breathe that environment and task every day. So rather than implementing a process or system into the workplace because we think it's right, we want to make sure it actually is. We do this by regularly engaging with the operational colleagues and our clients, finding out what their challenges are, but also what their ideas, and actually really listening to what their views are. This is actually where our solutions have come from. We then, as an SME community, will source those solutions. And sometimes that means looking outside of the box. Sometimes they don't exist in the marketplace. The other key factor is we don't just look at that productivity and cost. We too take a holistic view. Is it actually effective? Is it actually safer? Is it actually easier for the operator? And does it actually achieve the results our clients want, or does it actually do it even better? When we're ready to engage, as Anna said, to trial, we look at the data and listen to that feedback from both teams and clients. We do tweak, we revisit, sometimes with our suppliers, and as many times as we need until we have a viable solution that not only achieves those 4 tenets Anna covered, but the health and safety of the team and others working in the area. It's only then that we actually roll out to the business, as we know by then we have the right operational, sound solution, with all of that backup support of the health and safety behind it. So to demonstrate how this works in practice, we're going to cover a couple of the key targeted solutions we've been working on and what their outcomes have been.
So we wanted to cover floor care. So floor care is really important. We probably spend 70% of our time cleaning floors, both mechanical cleaning, looking at using different equipment and machinery. And when you look at our hospitals, they're actually massive spaces with really huge footfall. And the requirement for cleaning floors varies across different parts of different different hospitals. So outpatients will just have massive footfall, so will our public areas, and we're required to do things slightly different in wards and operating theatres and some of the other areas. It's also the area that creates the most slips and trips and falls, is around floors. So it's important for us to look at, well, what solutions have we got in place that help us to support health and safety in floor cleaning. So I wanted to start with microfiber. Now, we're going back a long number of years here. We started using microfiber 20 years ago. We were part of the then Department of Health trials for microfiber, but it's a really, really good solution. It's more productive. It probably is 20% more productive than using traditional cleaning. And I'm not sure whether you'd be surprised to hear, the people in the room, that traditional cleaning actually only removes about 30% of what's on a floor or on a surface, whereas microfiber, you're looking at around about 80%. So it gives you a better clean, it's more sustainable, it's better for our teams, it's much more ergonomic for people in it from a cleaning point of view. And as far as I'm concerned, there is really not a downside to it. And we'll talk to you in a minute about what it's done to our slips and trips and falls. We've also invested quite heavily in robotics, and our team from Sherwood are going to talk to you about that in more detail after this presentation. But robotics for us, we use them as cobotics, so they work alongside a colleague and really give a fantastic clean. They take away heavy cleaning from our colleagues, so they're more ergonomic, they're more productive. From an infection control point of view, they're better because they're more consistent, and we end up with a better quality finish, and they help with health and safety, removing slips, trips and falls. When we start to look at IMOPs, they create detailed cleaning on our floors for us. And then when we're looking at using non-chemical cleaning now. So we're looking at ozonated water for cleaning and also diamond pads. Both of these effectively using water or water-based systems. So we've no sticky residue from chemicals, much more sustainable. And actually by using diamond pads we get more slip resistance, and again supporting the health and safety agenda. So what have we actually achieved? So you'll see that in the last 5 years we've had no reportable incidents from our frontline cleaning colleagues in terms of slips injuries or manual handling injuries. We've had an 82% increase or reduction in the use of disposables, and they were going to landfill by using microfiber. We've had a 32% reduction in water and chemical usage by using all the techniques that I told you about and the different technologies. And we've had a 45% reduction in slips, trips and falls in our environments across that whole period, public, staff and team members. So the second technology that I wanted to talk to you about was decontamination. So not only do our teams need to clean, but we need to decontaminate. We work in complex environments with complex infection control requirements too. And we've been working with hydrogen peroxide and ultraviolet over many years. And these, for us, it's an evolutionary process, so these gradually change and develop over time. For us, hydrogen peroxide still remains the gold standard, give you a 6 to 7 log reduction in organisms, but it is very time consuming and it is chemical intensive. It uses lots of products that need to be treated in a completely different and very safe manner in terms of storage, transport, usage, and availability for people who are using the rooms. To augment hydrogen peroxide, we use ultraviolet decontamination, and we've recently, probably over the last 18 months, been looking at a tower with 4 satellite units. And this allows much more localised decontamination to take place, so we can actually place these satellite units more local to where the infection's happened. So if it's been a respiratory infection, we can place it around the head of the bed, should I say, so that we can decontaminate more locally. If it's been an enteric organism, it can go around where the commode's been or in the bathroom, for example. And you can actually place these satellite units over the top of a bed, under a bed, through a toilet seat, wherever it needs to go. So it's much more easy for the teams to operate it. So from an operational practice, our teams actually love this. This really helps to support decontamination. I always describe it as being a bit like Heineken, reaches the parts that other decontamination solutions don't reach, because you can actually use it in rooms where you can't use hydrogen peroxide. Still gives you probably 3 to 4 log reduction of organisms, and it's more ergonomic. But the most important thing is that we can get patients in beds much more quickly, because it's a quicker system to operate. So what does it actually deliver? So it takes half the time, so it probably takes about half an hour to decontaminate a full side room, en suite. At a mental and physical health side, we've had no reportable infections as a result of using the UV, both proactively and reactively, since we've had it. In an acute site, we've had a 50% reduction in our C. diff rates by using UV proactively and reactively, and of course there are no chemicals, so from a sustainability point of view it meets all the requirements.
So about 5 years ago, injuries from discarded medical sharps was a real concern, and we started a journey to really understand the why, how and what, as no one really wants to cause an injury like that just by a discarded needle. So the induction of the safety engineered devices into the NHS, that reduced it slightly, but there was still quite clear some work could be done. So the process again started with that engagement with our teams, and that was looking actually at their fear, but also their observations when they were working in the areas. But actually digging deep into the data, and it was looking at things like, where was the sharp found? What part of the body did it actually hit? The type of needle, and even to the time and day, and even what time of year were these actually being found. So that information helped us actually look at targeted solutions. So for example, things like location of the injury. We identified very quickly that quite a few common injuries happen between the thumb and forefinger when they were handling waste bags. So we actually designed a resistant liner, and we reinforced the liner in those areas. Now that's work that's still continuing, because I spoke to a gentleman earlier. Resistant gloves are really quite hard for people to have flexibility in their fingers, and we're looking at a liner that actually will give that flexibility, but it will also give that protection to our waste team. And we're actually trialling that at one of our key sites. But we also found we had injuries to the lower legs, and when we identified it is when bags were being carried. So we introduced the foldable trolley, and we mandated it across our business, and that was so they could take it from the operational areas, put it straight into the bin, carry it to the waste hold, and then put it in, reducing that time of when those bags might be touching people's legs. But we also looked at the challenges the medical teams had, because this was the key part of where this was happening. So we actually looked at the location of the needle bins to where they were actually doing the injection. And quite often you'd find the bin was somewhere over there and the injection was here. You're all nodding, yeah. So we actually do advocate with our trust to look at bins like the one you can see on the screen, that actually the bin is on a trolley. And that top tray is where they can put the paraphernalia to do the injection, but it means they can dispose of the needle straight away, rather than carry it, get distracted, and that's unfortunately how they get discarded onto the floors. So we worked with them. But this also gives a better bonus to waste management, because this type of bin, we work with Sharp Smart, there are similar companies, means that actually you only need to incinerate the needles, because the container can be fully decontaminated and brought back in. So you're not burning as much as with a normal bin. But the key was the awareness to our team. And also we wanted to be able to support the medical team, because sometimes, regardless of where they've been trained, they will have different ways of discarding of needles. And we wanted to help them with that, especially when they're already under pressure. So we created a short video with colleagues to highlight not just the correct process, but also the impact it can have on somebody when that happens. But this was all part of that culture to help maintain a clean environment. But that increased the risk to our teams, because quite often those bits that are discarded on the floor or even on food trays might be tissues that have actually had a needle wrapped in them to try and make them safe, or might have other hazardous substances within that tissue. So we needed a tool that was easy to carry, could be carried all the time, was easy to use, and was easy to clean. 5 years ago, that didn't exist. There was nothing on the marketplace that actually provided that. So as a company, we went out and we created these little things. I don't know if you can see these. These are called trash tongs, and I will be going in a bit more detail of those at a later slide. But we issue those to every single colleague. And it just gives them a safety device that they can pick up those items without injury and without worrying about the harm. So what has that actually achieved for us? As I said, we have 100% awareness across our teams on how to protect themselves, but how also to prevent some of the sharp injuries. Over that 5-year period, we've seen a 38% reduction in sharp injuries. And I know the clients I work with are really keen on that number. We've also issued over 20,000 of the trash tongs across our business. Now what that also is to our senior leadership team, because it doesn't matter who walks into your sites, we want to make sure they're clean. So we give them the tools so they can also help maintain that. This work will stay as one of my priorities, because the potential risk is always going to be there within our environments. And to be brutally honest, one injury is one too many. The potential consequences and the feeling it has for that injured person are horrendous. We're now going to play that short video that we created with our clients. What I would point out, these are not actors. These are individuals, when I asked the question, volunteered to take part in the video because they wanted to share their story, to make sure people understood the correct procedures at site, but also how it could impact them.
Really important to prevent sharp injuries because of the effect that has on staff, on patients, and also for the trust as a whole. So more often than not, someone will be infected, but they will have gone through a period of feeling really worried, of being depressed, of being lacking confidence, and it's all of that also is part of the problem.
As I went to take up the bed linen off the bed, I scooped it up and then I felt something sharp in the palm of my hand. And I had the initial shock, you feel quite angry, and then you feel quite hurt, because although you know the person that was deliberately calculated your mentality or sick injury.
I was asked to go in and do a deep clean on the room. As I come to collect all the rubbish, had my gloves on, ready to put it into a disposal bag, and I noticed I had a pain in my hand. So I looked at my hand and there was blood there. So sort of unravelled the tissues and there was a needle, I think my first reaction was shock. You always know that the risk is there, but you never really expect it to happen to you. Every action has a consequence. People really should think about their actions before following a procedure or doing a procedure.
The message to staff is that they should use a safety engineered device to reduce the risk of a sharp injury, and then when they dispose of the sharp, they should get rid of it immediately into the right sharps box, and they should dispose of it themselves.
I'm sure you'll agree that's a very thought-provoking video. I wanted to follow that with some of the external accreditations that we've received for the work that we do together effectively. It's all well and good us telling you all the things we've done internally, but it's also about how is it taken by people externally. So from the Royal Society for the Prevention of Accidents, we've received the gold accreditation for the last 14 years, and Jeanette's going to talk to you in much more detail about that. I wanted to highlight Sylvia Sinclair, who's one of our, she's actually a Deputy Contract Director at Whiston and St Helens. She won the Lifetime Achievement Award at the My Cleaner Awards. She was one of 4 winners, but lots of people who were nominated, and it's all about our people and about how our people deliver all of the things that we need delivered every day. And I just wanted to talk to you about Sylvia, really. Sylvia started as a laundry assistant at Whiston and St Helens, and she started when she was 16, and she's been there 50 years, so she's there still. She's there still today. And her journey through a career progression, her loyalty to the trust, her loyalty to Medirest, her passion for the job, shines through everything that she does. And Sylvia is one of probably everybody in this room could tell a similar story about their own career. And people working in healthcare really love it, but it's our responsibility to make sure that those people are protected and that we have the tools in place to make sure that they're safe in what they do. I also wanted to talk to you about the NHS exemplar status. It's really been fantastic that the NHS have been recognising the facilities teams in giving them an accreditation. And we're very proud that the Royal Surrey County Hospital was the first ever site to achieve exemplar status, and I can see Chris sitting in the audience there, for portering, cleaning and catering, and we provide the services at those sites, and it means such a lot to the people who work on the sites, to our clients, to the patients and visitors, and to the staff who provide those services. We've also been awarded through our clients at Barnet Hospital, another acute site, and more recently for 4 sites at the Southern Health. It's a mental and physical health facility, and 4 of their different sites received exemplar site accreditation, and it means a lot to us, but it means a lot to the people who work on the sites as well. And it's really lovely that the NHS are awarding these exemplar sites across different venues in the NHS.
So as Anna mentioned, ROSPA. Now ROSPA is an internationally recognised safety organisation, and we've achieved gold for the past 14 years of entering the Industry Sector Award. Now that kind of demonstrates the longevity and our history with safety. But this year, in 2024, we actually won the Industry Sector Award. And I think that's a testament to everybody across the board within our industry who genuinely cares about putting that safety first in everything we do. We also achieved the Innovation Award for our trash tongs, which I hope you see as a simple solution to an issue our teams face every single day. But through that data and engagement with all levels, it now gives them something that's easy to carry and prevents them from having injuries to the hands and fingers. When I've got the feedback again from the operational teams, and I think we're now on version 3 or 4 of the trash tongs, is that actually it makes them feel safer. It makes them feel they can carry on and do those tasks without worrying or stressing about what they might put their hands on. But we were also commended in that Fall Prevention Trophy. Now that's not just within a healthcare environment, that's across all industries. And they award that to companies who have innovated and worked to prevent falls and slips. And we were able to demonstrate the use of innovations such as the floor cleaning that Anna took you through, but also using things like the equipment such as the battery-powered backpack vacuum cleaner, try and say that more than once, removing the trailing cables for things like when they're cleaning in stairwells, but other things like the Skyvac that we use that can clean up to 6 metres from floor level, removing the need to use ladders, removing the need to use a MEP, again, reducing that risk of falls within the industry. But this is for us about that continuous improvement piece. And although that work to date, we've reduced those slips within that environment by 45%, we continue to carry out that engagement with our clients and looking at that data, and it still highlights there's a significant risk in busy public spaces where the footfall is usually very heavy, but also people tend to be rushing or distracted, or possibly already unsteady on their feet and therefore already more likely to fall. And usually it falls from things like rainwater or random spillages. And they unfortunately can result in some very serious injuries. These are often areas where there's no easy cleaning materials available for people just to mop it up. And so what we've actually done is we've developed a simple solution. Now it's similar to a cleaning station you might see in a factory for cleaners to go to, so it's easy access. But these boards are very much public facing. And that was through discussions with all users of those areas, so clients, visitors, our operators that I've had, who are saying, actually, if there was something that was easy for me to get to, I'd have cleaned it up. Because by the time the cleaner's been made aware, unfortunately, sometimes somebody has already fallen. So the idea of these boards is they can then be positioned in these areas just to give them some basic equipment to be able to clear up tissue, for example. But we're also aware there's some villages and hospitals where people are less keen to want to clear that up. So again, on the board, all we're asking them to do is put out a warning sign and notify us. What we're hoping is that will reduce the risk because people will then be aware there is a hazard. We do have prototype number 2 down on our stand, so do please come and have a look at it. Prototype 1, which you can see in the picture there, we didn't have an alcohol gel dispenser on it. Again, talking to the frontline team, one of them said, well, what about decontaminating my hands afterwards? Fantastic idea. Let's add it to the board. As I said, these are the people who will give the solutions to us, to the problems we all experience. This is only one of the exciting solutions we're looking to continue that journey, improving safety across the industry and improving our services.
So what does the future look like? For us, really, it's all about integrated FM. So it's about working on an integrated basis, but it's also all about data. We wouldn't have been able to present any of the slides today or provide any of the information without having the data to support it. And we need to understand from each of our teams what's actually happening in a real-life environment and how it varies from site to site. What's happening by time of day, day of the week, and as Jeanette says, by time of year as well, so that we can make sure that our services are really tailored to, what's happening on a site and make it work locally on a site. So it's about 360 communications to maximise safety, improve productivity, to make sure that we're providing sustainable solutions wherever possible and that we're measuring our sustainability, that we understand the impact on infection control, that we're always innovating, and we would do that through total FM solutions. And I just wanted to mention about the E15 logo. We've got somebody on our stand downstairs. I believe it's the atomic symbol for phosphorus, and he'll tell you all about that if you go and see him later on.
Thank you very much, Anna and Jeanette. It's been a pleasure for us to come and talk to you today. I hope you found that useful, and we'll be staying behind for a few minutes if anyone's got any questions. I just really wanted to reiterate, for us at Medirest, it's all about performance at heart. That's our strapline, that's our motto, and we really do mean that because our people are everything to us, and their safety is kind of paramount. So hopefully you share that with us. And there's a QR code on the screen if you would like to access our website. Alternatively, we are down on stand 1 in the exhibition area, and we've got fully integrated soft services solutions that we can provide, but we also do have a consultative arm called Medirest Focus. So if you'd like to come and talk to us about that, then we're more than willing to come and to talk to you about that as well. So thank you for coming, and thank you, ladies.